A very warm welcome to StudyIQ, my dear friends. I am Prashant Mavani. I hope you all are doing good. Today is 6th June 2020. Day is Saturday. I would like to start today's discussion with this quote by Sir Charlie Chaplin. A day without laughter is a day wasted. Now, I'm sure we all are aware about this thing that laughter is a very interesting, very important, one of the best medicine, and this is proved as well. Now, the question is how to attract laughter. I have a small tip for you guys. I want you guys to give it a go. When you start your day, right, when you're awake, carry a tiny smile on your face, right? As soon as you awake tomorrow, right, make sure you smile. For no reason, just carry a smile and then step out of your bed. This is a small seed, a smile, I believe, is a small seed. If you do this thing, then you will find that laughter, you are basically creating an environment. You are starting your day with a right foot. You are starting your day by creating this situation where laughter means when you smile, right? When you start your day with a smile, you are basically attracting laughter towards you, right? Give it a go with this difference. StudyIQ team has prepared a smart course. Now, this smart course is for Civil Services Examination. This will help you with your mains as well as prelims examination. I'm sure you are aware about the fact that 4th October 2020 is going to be your prelims date. So, start your preparation sincerely, right? Take it easy, but start it sincerely. I'm not saying seriously. Seriously and sincerely, big difference. So, start sincerely your preparation. You have 4 months to go. Good time for revision, good time to sort out your doubts and everything. And my best wishes and my support is always with you guys, and you can make the most out of this smart course as well. To find out more about it, download our mobile application. Till 10th June 2020, you are getting this EMI option as well. Download the PDF of today's lecture from my Telegram channel. You can follow me on Facebook. Please make sure that you share this lecture with other students. Hit the like button if you have learned something from today's discussion, and don't forget to subscribe to our YouTube channel. We have 4 articles on our table. The first one is Shine a Light. This one is about medical journal and data. Second one is about COVID testing. Very interesting editorial from Economic Times. We have one very interesting article on drone from Times of India, and the last one is about pharma industry. So let's start our discussion with the first one, Shine a Light. Now, this Shine a Light is about data and wrong methodology, or when you are relying on not that relevant data, then it will impact your results. I'll give you examples and so many things. So I'm sure you might have heard about this organization called the Lancet. Lancet is one of the most reputed, one of the most influential medical journal in the world. Now, 2 weeks ago, the Lancet came out with this study, and this study claimed that there is no benefit of HCQ on COVID-19 patients. You can imagine when one of the most influential, one of the most reputed medical journal, when it says that there is no impact of HCQ on COVID-19 patients, then there are so many countries they are going to take it seriously. There are so many organizations they are going to stop their research on HCQ and COVID-19. So that's what happened, and the same data that was used by this Lancet study was used by WHO, and WHO came out with this reason that keeping in mind do no harm principle. Do no harm principle is a thing, or it's a principle. How it works is that if I cannot do something better for you, then it is better for me to leave you alone rather than doing more damage to you. So if I'm trying to help you, and if I cannot help you anymore, then I should make sure that I do not harm you. So following this do no harm principle, WHO as well suspended drug trials pending a safety review. The data that was used, it was claimed that 96,000 patients' data was used from 671 hospitals around 6 continents. So we can say, judging from the surface of these facts, we can say that this data is one of the most holistic as well as most if it's coming from 6 different continents, from 671 hospitals. So this is one of the most versatile data that we can have to see whether this HCQ is working on COVID-19 patients or not. And after this decision of WHO, some European countries did the same thing. Now, another study involving some of the same authors and relying on the same data published the New England Journal of Medicine, which sought to answer questions on associations between cardiovascular disease, COVID-19, drugs that target the enzymes that play a role in facilitating the virus in attacking a host, has also been retracted. So why these studies are retracted? What is the reason why they are being pulled down from their published platforms? What is the main reason? The main reason is that some scientists are not at all happy with the methodology as well as the data set. Methodology is basically the method that you are following to collect data, or the method that you are doing or following to conduct a research. There can be primary data, secondary data source, primary source of data, secondary source of data. If you are using, let's say, primary source of data, then it should be reliable. You can use both, right? Means I can go on and on. I have studied research methods, so I know how it works. I know basic things about how it works. Not basic, but master level thing, like how it works and things. But to keep things simple and in layman's language in front of you guys, the best example that I can think of is the Hindu newspaper and the Hindu analysis video series. The Hindu newspaper is a primary source of data. So I'll give you one example. Let's say that, as you all know, that I make this video lecture or video analysis based on the Hindu newspaper predominantly. So if the Hindu newspaper is, of course, the first source or primary source of data, the Hindu analysis video is secondary source of data, right? Based on whatever we find in the Hindu newspaper, the most important things, of course, right? You will find the same thing, or things based on the data that is available in the newspaper, you find the same thing. Means the analysis will be based on the data that is available here. So just imagine if the data that is available here is wrong. So what's going to be here? They're also going to be, means the discussion or the things that we are going to talk about is also going to be wrong, because the data here is the main, the main thing, the main ingredients are wrong. Then your recipe, your final product is going to be wrong as well, isn't it? If your input is not proper, then how can you expect your output to be of best quality? So the methodology and the data that was used by scientists or used by these people, these organizations here, was challenged by various different scientists, independent scientists. They are not happy with this thing because of the lack of good quality of this data. SSC Corporation. This is the organization from whom this the Lancet and this WHO, they got this data of this 671 hospitals and around 6 continents and some 96,000 patients. Now, when these questions were raised about this, scientific nature or this reliability of this SSC Corporation's data, SSC said that there are some ethical issues and we cannot share this data with you guys because of confidentiality. And they are giving, this organization and the people are giving excuses, right? It emerged that mortality attributed to disease in Australia did not match with the country's own estimates. Second point, there was no way to tally patient records and the hospitals were sourced from. There was no means when you go to a hospital, let's say you have collected this data from 671 hospitals. Now, out of this 671 hospitals, if you visit 2 hospitals to find out whether Mr. X, as it is claimed by this data, that if Mr. X and Mr. Y, both of them are admitted in these 2 hospitals, and when you go there and you find out that they were never there. So you cannot rely on this sort of data. It should be open in the sense, if you have collected data, then why you are hiding it? This SSC Corporation is saying that confidentiality is there and the way they have collected data. So it's very fishy. We cannot rely on this sort of organization. The other problem that we find is that nowadays people, or this, we are living in a very strange culture that just like fast food, we need fast results, right? We think that it's like a magic wand. You just use your magic wand and you will get your results. Peer review takes time. Peer review basically means that if you are writing something on, let's say if you are a psychologist, right, or so-called psychologist, and if you write something, if you write write an article in a journal, then other psychologists are going to go through that article, and they will either agree with you or they will challenge you. If your methods are absolutely non-scientific, then they are going to be not happy, and they may bar you from writing these articles. So this is what peer review is all about. Peer review will make sure that whatever you are adding or trying to add is proper, right? It should be scientific. It should not be just like anything that you can write, and anything that you write is okay. No, everything written is not right. Keep this thing in mind, right? It should be peer reviewed. This is the most important thing. There will be so many eyes, so many eyeballs checking your work. So you cannot, means fake thing cannot run for a long time when you have this peer review system. But peer review system will take time. So will this clinical trial process, right? It will take months for you to come to a result. But this is the thing. We cannot, take science or methods for granted. You have to follow those things. That's what science is all about, isn't it? So the key lesson here for the whole world is that we cannot assume that the scientific process is divorced from influence of power, privilege, finance, and politics. We find this sort of things in scientific process as well, and this is very unfortunate, but this is a dark reality that yes, we find pressure of money, this finance pressure from politics, or your personal agenda and other things. All these things they have impact on scientific process, and this is not a time for this sort of money making business, or just following your personal profit goals or selfish goals. We don't want to engage into blame game as well. When I say we, I'm talking about the world, right? We need openness. We need scientific data sharing. We need to learn from each other. When I say each other, I'm talking about different countries and different organizations. They can learn from each other, because this COVID-19, and this is not just COVID-19, that is the only problem. In future, we may find some other diseases like COVID-19. So this is, you're building a base of cooperation. It should be clean. Moving on to next item, improving India's COVID testing rate. The number of tests for COVID-19 are not rising in India as fast as would be desirable, and this is a matter of concern. Now there can be one excuse for it. The excuse is that we don't have that many testing kit, or there is constraints on the supply of kits. If it would be the first week of lockdown, that I would understand that yes, this is possible. But now we have experience of, roughly speaking, 2.5 months or more than that, and not just our experience. We have experience from the from the world as well, from various different countries, how they have handled this disease and things like that. So this is not an excuse, and this is something that is difficult to digest. Second thing, which is quite logical, and it is a reality as well, that there are many states, they are doing it for purpose, right? A deliberate design on the part of several state governments to restrict the number of tests so as to keep their tally of acknowledged COVID cases down. Some states are tailoring their testing norms to present a picture of complete handling. They are basically creating a mirage, right? And I think they are also living in this mirage. They are, what is the right word? They are far away from reality. If this states and state governments are thinking like that, keeping or hiding numbers and not testing that many people, they will go scot-free. That's not right. This is a reality, right? What you are thinking, that COVID-19, if in your particular state, if 1,000 people are infected with COVID-19, then no one will know about it. Today or tomorrow, you will find their symptoms. then what you are going to do after that? So this is not accept. This is a crime, right? This is one of the biggest crime, I would say, that you are doing this thing for purpose. So there should be a proper committee on this thing. This is not acceptable. How can you play around with, if this is a reality, that if some states are tailoring their testing norms to present a picture of, for their political profits, for their, for their political brownie points, if they are doing this sort of things, if they are playing around with people's lives, citizens' lives, then this parties should be uprooted. We don't need this sort of ideology at all. From where they are getting this sort of ideas, like not doing a proper testing. Okay. Now talking about solution. Our country, we have a very good experience in handling HIV/AIDS. Back in days, we created this National AIDS Control Organization, NACO. So the question is, should the center set up an organization to monitor testing and data, drawing on experience of one of the world's success stories on tackling HIV/AIDS, that is NACO, NACO. Yes, of course, we can create an organization just like NACO. We can give it a name, NECO, that is National COVID Control Organization. This National COVID Control Organization will do testing, it will monitor testing, it will collect data, it will, keep an eye. And this NACCO will be controlled by ICMR. ICMR is a regulatory body which can well supervise the working of such testing agency. Why we need this testing agency? Why we need NACCO, NECO? Because we need a uniformity of testing protocols across states. We need a standard operating procedure. We need to set targets, right? It should be like your sales, when people working in sales environment, they chase a target, right? The higher the target, if you give them target to achieve 100 units, right, they will end up somewhere around 85 units. Okay, 85 achieved, then you set your target for 101, they will achieve 87 or 88 or something like that. So you keep on raising the bar and you keep on pushing people, right? It's not just about pushing, right? You also change the operations. If there are some bottlenecks, then you remove them, so that every single thing that you can do to add more speed, you should do it. So this is the environment that is required, and this is achievable if we create a dedicated NACO and standard operating procedures, and if we are constantly working on improving this whole testing system, then yes, we can do it. And there are plenty of testing kits are available, because ICMR has validated large number of testing kits that have been developed. A plentiful supply of testing kit is also available, and we have so many factories, so many companies, they are producing it. So this excuse is not acceptable. And the second thing that we discussed is basically a crime. So that is also not acceptable. So only one thing that we have at present, or one thing that we can do, is we can create this organization as soon as possible and start conducting testing as many people as you can. Moving on to easy regulations to make India a drone hub. Now, those students who are following daily financial news analysis from its inception, then you would be aware about, I think you may recall this discussion, a special topic that I delivered. Daily financial news analysis was about drones. I gave you examples like the way drones are used. I talked about military drones as well. Today we are not talking about military drones. Today we are just going to talk about civilian drones, normal drones that we can use in our society, and various different organizations, they can use these drones. So a few months ago, I think it's been nearly 3 months or more than that, I talked about this topic, that how New Zealand is using, Domino's in New Zealand is using, in some cities it is using drones to deliver pizza. Then blood is being delivered in various different countries, right? If you need blood, then blood will be transported using drones. So you can transport a bottle of blood from one place to another in the quickest possible time. It's been used in medical field as well. It can be used for photography, for videography, and there are so many things that you can do with drones, right? It can create so many jobs. This one item can create so many jobs. Anyway, what if we can learn from this lockdown, particularly the sale of cigarettes and alcohol? The thing is that any form of restrictions on usage has always been detrimental to industry, consumers, as well as state exchequer. When during this lockdown phase, when cigarettes were not available, people used to pay 1,000 or more than that, even 2,000 rupees for a packet of cigarette. Normally you can buy it for 100 or something. People were paying 2,000 rupees for that packet of cigarette. The reason is because it was restricted. So industry made nothing out of it. Industry has already sold this thing for maybe 90 rupees to the wholesaler. Consumer paid huge amount of money. State got zero as far as tax is concerned. And the only person who made the most out of it, or the only party, was this black marketing people, right? So whenever you restrict something, whenever there are restrictions are placed on anything, it is the people who are doing black marketing. They are the ones who will benefit out of it. Same thing goes with drones as well. The problem with drones in India is that our regulations, our policies are very restrictive, and this is the main reason that we don't find that many drones in our country. You find drones just in marriage functions and things like that, and that's it, right? Maybe a few cities they are using drones for traffic management, but the way their potential, right, it is nothing to their, I think it is just a 5% of their potential. The Indian drone market is expected to touch $885.7 million, and this is somewhere around 4% of global market of this drone. Global market is $21.47 billion. At the same time, Indian market accounts for 20% of global imports. We import 20% of drones in our country. So this indicates that the demand is there, but the only problem is that we don't have that ecosystem where we can produce drones and use drones, and you can learn from and fly drones, and there are so many things. As you know, that drones can be used for various different purposes: agriculture, highway, mining, railways, etc. Now, China, USA, these countries, they are known as hub of manufacturing drones. They have this ecosystem. One side research is going on, the other side manufacturing is going on. Then you are learning new things, new ways, new uses, then policies are getting updated. So they are continuously developing and improving this ecosystem. In our country, it's like, it's like infanticide. It's like basically killing your baby before it, not giving chance to your baby to grow. It's something like that in our country. Drone regulations are too obstructive. Intelligence agencies, they are estimating that in our country we have some 6 lakh unregulated drones. 6 lakh unregulated drones with various capacities and sizes. And the reason why they are unregulated, because our regulations are too too restrictive. 2014, Government of India came out with this strict laws regarding this drones, and then Civil Aviation Ministry came out with this no permission, no takeoff clause in 2019. So when government came out with this new clause, government was claiming that it is basically upgrading this whole regulations associated with drones, and it's going to change the way drones are operated and everything. But even today, this 2019 Civil Aviation Ministry's NPNT clause is restrictive. All drone manufacturers need to have an NPNT, that is no permission, no takeoff software. And without this software, you cannot manufacture or sell these drones in our country. Now, government is saying that this process, like getting permission, is very quick, because government is saying that there is this digital sky platform where you apply and then you will get permission. But this digital sky platform is still non-operational in our country. Government is not just only talking about software, but on hardware portion as well. Hardware side, government is giving you specifications that you need to use this sort of hardware, this sort of material and other things. So software side, hardware side, government is creating boundaries. When it comes to permission, its own platform is not working, and you won't believe, but the regulator, that is the government, also lacks facilities to test and certify drones for airworthiness. So government is not at all prepared. It is nothing. It has nothing with the drones, and then it wants to control this drone industry. If you compare it with other countries, China and USA, their companies have started getting capital investment from other companies, and they are, as I told you, right, their drone ecosystem is getting more and more mature. Here it is getting more and more rigid. So we are going to be the laggard state. It means same thing happened. What happened with this defense products that we are importing now? Same thing will happen with drones, that we have to import it. So if we don't want to see this situation, then we need to make sure that our regulations are progressive. We are providing a platform, as a government is providing a platform where people can run, they can take off, they can fall, they can do anything they like. Or a government will just provide you a platform. So that's what we need now, if we want to see this make in India, and if we want to see our country as a manufacturer, as a hub of drones. Moving on to last item of the day, it is about this pharma gears. Now, I'll take you through this. I'll tell you the limitation of this particular article, but there are some interesting facts here. Medicines are among humanity's greatest achievements, and this is a very big statement, very writer's statement, that yes, medicines are among humanity's greatest achievements. I want you guys to think about it. Then, if we go through some facts, then the global market for pharmaceuticals is currently worth 110 lakh crore rupees. 110 lakh crore rupees is 1.7% of global, or you can say gross world product, or global GDP, right, to keep it simple. 1.7% of this gross world product. So you can imagine how big it is. Roughly 55% of this global pharmaceutical spending, that is 60 lakh crore, is for brand name products, which are typically under patent. So how it works is, if you invent something, then you will get 20 years product patent. So you have this absolute monopoly, and this monopoly is given so that because you have spent huge amount of energy, money, everything for a very long period of time, or maybe for a short period of time, but you took this risk. So you should at least get some sort of monopoly, so that for next 20 years you have license for that particular item. You are the one who are the main owner for next 20 years. And if someone else wants to produce your item, then you can issue license to that person, and you will get royalty, and you will basically make money out of your invention for next 20 years. That's how it works. Now, commercial pharmaceutical research and development is very expensive. You need huge amount of money. You have to take risks as well, no doubt. It's not like that you will get success in just your first trial. But keep on doing it. You may find so many failures as well, or you may achieve no results at all. And after a few years, you may achieve results. So this thing is okay. This thing is quite logical. That means if you don't have this sort of monopoly, then what will happen is it will not motivate people to invent, and that will be a big loss. So this system is so far so good. The problem is there is no limit on profits. A thing that you can produce for 1 rupee, you can sell it for 1,000 rupee, or maybe 10,000 rupee. Can you believe this thing? And this is a very common thing. Trust me, this is in United States, 1,000-fold markups over production costs are not atypical. In India, the profit maximizing monopoly price of a new medicine is much lower, but similarly unaffordable for most citizens. A medicine that will cost you just 1 rupee. In our country as well, we find it that medicine will be sold for 1,000 rupees, or it all depends on how desperate the patients are, or which particular disease you are targeting. There is a proper business about it. Means everything is calculated here, that they know exactly, like if you're just a this headache medicine, it's a very, so headache medicine business model is to produce more in masses and to sell it as many medicines as possible. People will not go and buy one medicine in medical store, right? If they go for a painkiller, they will buy a strip. Now, many people, they buy one strip, and many of those strips, they go outdated. But companies are not worried about that. Companies wants to sell as many as possible, so they come out with this attractive advertisement and attractive marketing strategy and other things, right? Then you have your commission of doctors and this pharmacies, and this is whole chain. I'm sure you are aware about all these things. It is said that they spend some 14 lakh crore rupees after R&D per year. This is big amount, and to recover this amount, you need you need to make profit, no doubt, right? Profit is part of everything. Whatever you do, as far as it is private business, then profit is going to be one of the main driver, motivator, and there is nothing harm in it as well. You are providing value for money product. But if you are charging this much, if a car that you produce for 10 lakh rupees and if you are selling it for 20 crore rupees, then people are going to ask you questions like, this is just costing you 10 lakh rupees and you are selling it for 20 crore. Unfortunately, we don't find the same thing in pharmaceutical business, in medical business, particularly this pharmaceutical business. The reason is, that most of these innovators, they are not concerned about those diseases that are quite common, or those diseases that are killing so many people. Like if you talk about tuberculosis and malaria, then it kills some 1.7 lakh people each year. But R&D spending is just 0.12% after these diseases. These innovators, they are motivated, because of their money. Means they are motivated, means their main purpose is money making. So they will focus on those medicines, those diseases that will help them achieve achieve their targets, or making more money. Simple is that, profit maximization to be precise. So they don't do research in these things. Even if more people are being killed because of tuberculosis and malaria, they'll focus on those profit maximizing segment. And this is one of the main problem that's going on, and no one is there to stop them. And they have this good nexus as well, with government and with officers and authorities and things. Then they have this one more thing, that they will get license from someone else, and they can produce those medicines at a very cheaper rate, and they will sell it to other countries at a higher price. So large number of affluent or well insured patients are there, so their money will be, means if I have insurance and if I take some medicine, if it costs me 50,000 rupees, and if my insurance is going to cover it, then I'm not going to be worried about the price of that particular medicine. So this is, again, more and more people are getting insurance, and this is a sort of money making business for pharmaceutical company. And so these are the things that are going on, right? Basically. Now this article is suggesting health impact fund. This article is saying that we need to create a health impact fund that will provide you money for research and development. But this article, if you go through this article, then you will find that it has limitations. First of all, it is not clear at all, right? You can take this article till here only. When this article starts talking about, the writers are talking about this health impact fund, they are not clear how this will work. They are just, I think the suggestion is quite vague rather than being more scientific, because they are not clear about what exactly they mean by health impact fund. They're talking about that we need to keep some 20,000 crore rupees. Like, from where we are going to get that 20,000 crore rupees, how we are going to give that money to these pharmaceutical companies, means nothing is clear about this thing. But so far, these facts are, I think, enough for today's or this particular discussion. Like, these are the true facts, that look at the size of this pharmaceutical industry, and things about R&D and this profit maximizing, as well as this insurance. These are the things that are the points that we have discussed. These are the most important points that you need to keep on your mind. In future, if we may find something about this health impact fund, then we will definitely talk about it. But this one is particularly, this article is not clear, and if you want, you can go through it. Right, you will find it. Means after this, means you cannot understand what they are trying to say, because I think they are not clear in writing. News items, dear friends. Of course, you can download the PDF of today's lecture, and these are a few news items that I want you guys to go through, and that's everything as far as the Hindu analysis is concerned. I will see you on Monday. Tomorrow is Sunday, so no analysis tomorrow, directly on Monday. Till then, enjoy your weekend. God bless you all. Jai Hind.